it. I know whenever I go visit the Sunnydale neighborhood, a lot of newcomers, they say, "Oh, no, thanks for coming. Councillor Veith has been here 4 times this month." So hard to keep up with the councillors, but anyway, I think this councillor certainly set the bar of what we'd like to see in the coming term, and the city management was here and now taken to prepare their business plans, and we've certainly all been here to hear you. So thank you very much, and look forward to your immigration forum in November.
Thank you so much. Thanks a lot.
Next up, KW4 Ontario Health Team proposal with Dr. Jolie presenting. First up is not Dr. Jolie, but Dr. Jim Bowman. Welcome, Dr. Jim.
I'm not a doctor, let's make that perfectly clear. Dear members of council, members of the community, fellow colleagues, over the years, the City of Waterloo, along with numerous health providers in this area, has delivered programs and health-related services to our community. These programs have been supported by a grant from the Province of Ontario to the Ministry of Health and Long-Term Care. These grants have been managed through an agreement with the Waterloo-Wellington LHINs, or Local Health Integrated Network, for those who may not know that acronym. As you are aware, the province is modernizing
in Wilmot, and the reason why that's clustered together because in healthcare terms, that's how it functions. So with the 2 hospitals, the medical staff, much of the healthcare sector kind of relates to itself in that organizational framework. So the Ministry of Health has an ambitious plan for Ontario. I think that's fair to say. Yes, the dissolution of the LHINs across the province and 6 major agencies into this massive agency called Ontario Health. I'm a family physician. I've been here in KW for 31 years. My wife is also a family physician. I've been involved in lots of stuff, helping to create the downtown regional medical school and the pharmacy school and lots of stuff. To us and to many in healthcare, this is the biggest change in healthcare in Ontario ever. And I don't say that lightly. And it's very ambitious. If you look at the slides, I mean, they're very nice things the government says that we should be doing. We should be working together. We should be for the betterment of the citizens of Ontario. And it's very hard to argue against the lofty vision and goals of that. I think, I think most of us believe in our hearts we can do better. We can serve the people of this region better, cheaper, and do it in a happy fashion. This Ontario Health, it's just created. It's bare bones right now. They have an interim CEO, they have a new board, and they have virtually no actual structure stuff right now. And you're talking about the biggest expenditure in Ontario, the Ontario budget. There is something called a quadruple aim. The quadruple aim is what I was saying. It's the vision for this, which is a good vision, I think. Most people would say, we should have better experiences for the people we serve. We should have better outcomes for the populations that we serve. We should have good value for the money we spend, because we spend a lot of money in healthcare, and it should be good for the healthcare providers so we don't burn everybody up into a little crisp. And so that is the quadruple aim. For our area, in what is or was our LHIN, we had 4 subregions. So there's the Guelph area, there's the rural Wellington area, there's Cambridge and North Dumfries, and then we are KW4, as I say, Kitchener, Waterloo, and the 3 W townships nearby. We are by far the largest area in the LHIN. We have more than half the population of the LHIN. It's about 395,000 citizens in our proposal. It's a new model. It's to have teams be created to share funding. It bundles funding of hospitals and every major healthcare institution in this region together to work for people together. The province has stated they are aiming for 30 to 50 of these teams across the province, roughly serving a population of 300,000. There is a timeline, again, an ambitious timeline, which is a little behind, not surprisingly. We did submit for our KW4 area an application on May 15th. We are in process. The Deputy Minister has contacted me to say that, that they have received it and they are reviewing it. They will let us know in early July what the status of our application is, and the first Ontario Health teams will be designated in the fall, and there will be a rollout starting in the fall of this major transformation of healthcare. That's just some of the timelines. Because we don't feel like we can boil the ocean, there's a focus that we want to have in our region. And there's two major drivers for what the focus is. One is what's the need of the population here, and secondly, where have we had collaborative success in this region? And the two areas are the medically complex and socially vulnerable, and the second are the frail elderly. So for the medically complex and socially vulnerable, we're talking about homeless folks or people who have unstable housing. You heard about immigrants and refugees. Those often have social and medical complexity. We do have a number of programs that in healthcare that do transcend many sectors. Working hospital, primary care, long-term care, many crossing the many sectors of healthcare together with various programs. For the frail elderly, that is another area where we have had need and success. The demographics of the population are aging. We do have things like a regional memory clinic, which is actually provincially recognized, actually nationally recognized as a model, which is actually made here in KW. The Research Institute for Aging up in with the Schlegels is the home of that innovation, and I think it's a source of pride. And that type of approach to the frail elderly folks is something which, again, we have tied together hospitals, long-term care, primary care, community care, palliative care, and so on together. There's a bunch of things that we've done together. I wear multiple hats. So, with regards to disclosure, I'm the chair and lead physician of the Center for Family Medicine, which is the largest family health team in the region. I am a director for McMaster to help the medical school. I am also the clinical lead for the LIN for this region. So just in events of disclosure, there are a number of things that we have done trying to tie these things together. So it's not like this, nothing has been done, but this is continuation and I suppose a forcing together of many sectors. We have many, many signatories on it. In fact, you would say every major healthcare institution in this region has signed on. There are 31 signatories to this, including the 2 hospitals, all the primary care teams, long-term care. I mentioned the Research Institute for Aging and the Schlegel organization, many mental health and addictions agencies, many other community agencies. The University of Waterloo is also signatory of this, and we have actually more than 33 letters. We have many, many letters of support for this, so a very broad representation in this area. So I invite any questions you may have of this happening.
Well, thank you, Dr. Joe, for what you do in the community, and thanks for those. The signatories list is like a who's who of all the organizations that are beloved within our community. So it's really good to see that that's the strength of it, the grassroots nature, and it's just this. We really want to have council here is the entire structure and how large this is and how much work there is to do. So with that, I'll turn over to questions of council, and Councillor Hanmer. Is it an educated question? I bet you.
It will be. Through you, Mayor, Dr. Joe, Dr. Lee, thank you very much for the presentation tonight. And I think also I'll echo the Mayor's comments. Thank you for the leadership you've shown over the number of years. You're very humble in all the things that you've done. And I truly believe that primary care would not be where it is today without the leadership you and your team have shown. So thank you for that. I do think we're in really good hands with this proposal going in. I do have a question, though, with 158 that have been submitted and a plan to roll out 30 to 50 teams. You never know, they might roll them all out at the same time, but saying that they're going to do it in a staged approach, and let's say we're not part of step one, what things can we expect will continue to to continue the direction for coordinated care in this area?
Yes, thanks, Sandra. Well, first, we don't know how the ministry will decide. My understanding from many meetings and provincial level meetings is that the province has likely chosen 5 to 10 sites that they for various reasons will just approve in the first wave. And that won't be KW4. And we were not even aiming for that. We want to be in the first 30 or so, because I'll just be very frank with the audience that I think if we don't do this, this region will be left in the dust with regards to funding and healthcare for the citizens of this area. So I'm deeply concerned if we are not successful with this. So there's a large motivation. The motivation is beyond this application. There has been a lot of activities and actually coming together on many initiatives here. The 31 signatories have actually agreed that regardless of what the province says, we will work together. Because the vision is actually correct, to work together better for the people that we serve. And that's very hard to argue against. And we should do that, whether we are going through this process or not. And so we have a meeting tomorrow to try to continue making plans. And I truly think that one way or another, this region will be very hard for the province to ignore in doing something for it. And so with so many applicants, I mean, it was predicted that there would be a lot of applications. We're not particularly afraid. In fact, Ron Gagnon, who's, as you know, the presidency of Grand River Hospital, he told to me, he said, Joe, I'm afraid our application is too strong. I don't want that to rush things too much either. So I think we're fine where we're at.
Thank you. I would agree with that. I think this area has a very strong reputation of just moving on with things, and so I can see the groups working together, and I'm hopeful that we can continue moving in that direction. It'd be nice to be part of the first 10, but it also may be better to be in, as you've said, within the first 30, because they can work out the bumps in with the others. So again, thank you for your leadership in this area.
Thank you.
Further questions to the delegate? Seeing none, thank you for that 10-minute lecture on changes in healthcare throughout Ontario affecting our citizens. It was very informative, and good luck.
Thank you very much.
Thank you, Joe. Moving into section 11, our formal public meetings, and the first one is with Rita. So let's see. This is a formal public meeting to consider item 11A, zoning bylaw amendment Z 1709, Maison Canada Holdings Limited for 185 King Street North. Any persons who want further notice of this application, including the passage of any bylaw, should sign the appropriate register in the binder located on the desk at the rear of council chambers. If there is more than one binder like there is tonight, please make sure you're assigning the appropriate one. Will the clerk please advise council of the method used to give notice of the meeting and the dates notice was given?
Notice was advertised in the Waterloo Chronicle on June 6, 2019, and mailed or emailed on June 4, 2019, to all property owners within 120 meters of the subject property, to public agencies, to all persons who signed in or spoke at the informal public meeting held on June 12, 2017, and to all persons who requested further notice.
The planner, Rita Zielak, will now give a brief overview of the application. Welcome, Rita.
Thank you very much, Mayor Jaworski. Members of council, ladies and gentlemen, this is a formal public meeting for 185 King Street North, zoning bylaw amendment Z 1709. The application was submitted by Maison Canada Holdings, represented here tonight by Steve Jefferson of K-Smart Associates. The subject site is located on the southwest corner of Bricker Avenue and King Street North, located across the street from Wilfrid Laurier University. The site is well served by public transit and is located within about a 15-minute walk of the Waterloo Park LRT station. This is a picture of the existing 11-story, 37-unit apartment building located on the subject site. The applicant's proposal is to convert a portion of the existing ground floor amenity area within this building to a restaurant-type use. This is a conceptual partial first floor plan submitted by the applicant. The proposed restaurant area is shown for you in orange, while the proposed amenity area is shown for you in blue. To accommodate the restaurant use, the applicant is requesting to reduce both the residential and the commercial parking rates on the subject site. The official plan designates the subject site mixed-use, high-density residential, which allows for mixed-use buildings with ancillary commercial uses, including restaurants. In terms of zoning bylaw 2018-50, also known as the new citywide zoning bylaw, the subject site is zone change application, or ZC. The intent of the ZC zone is to ensure that the zoning regulations applicable on the lands on the day before the effective date of the new zoning bylaw continue to apply. As you can see, the land surrounding the subject site, containing apartment buildings over here and here, have been zoned residential mixed use 81 or RMU 81 within the new zoning bylaw. Prior to the new zoning bylaw being approved by council, the subject site was zoned multiple residence 25 or MR 25 within bylaw 1108, which permits apartment buildings but does not permit any ancillary uses. The zoning bylaw amendment as recommended by staff is summarized on the slide. Staff is recommending to rezone the subject site within bylaw 1108 from MR 25 to MR 25 with site-specific provisions, and to rezone the subject site within bylaw 2018-50 from ZC to RMU 81 with site-specific provisions. This table breaks down the site-specific provisions as recommended by staff. They're shown in purple for you, while the MR 25 zone requirements and the RMU 81 zone requirements are shown in gray. Staff is recommending that a cafe, restaurant, a takeout restaurant use be permitted as ancillary uses within the MR 25 zone. The restaurant parking rate to be reduced to 2.7 spaces per 100 square meters as permitted by the RMU 81 zone. That the residential parking rate be reduced to 0.83 spaces per unit, and that a visitor parking rate be introduced to the MR 25 zone, again to follow suit with the requirements of the RMU 81 zone. Staff is also recommending that a parking space width of 2.8 meters be permitted when a parking space is abutting either a wall or a column. This is to recognize existing conditions on the site. And also that there be no loading spaces required for the restaurant space, following suit with the RMU 81 zone requirements. In addition, staff is recommending that the restaurant space be limited to 74 square meters in size, and that a minimum 130 square meter amenity area be provided within the existing building. In conclusion, staff is recommending that council approve zoning bylaw amendment Z 1709 for 185 King Street North in accordance with section 7 of the staff report. That concludes my presentation. If there are any questions, I would be happy to answer them.
Required and at the time of original construction of this building in terms of amenity area? Because I know that was an item we talked about, the informal.
Sure. So at the time when the applicant submitted the building permit, there were no zoning requirements for amenity area within this building, but there was 233 square meters of area provided within this building. There was no zoning requirement for it, though. Okay, does that help?
Yeah, so staff is through this, recommending